something from experiences that you've gone through at that young age. The next one is from 18 months to 3 years old, and that is autonomy versus shame and doubt. So again, and then you have your 3 to 5 year olds, which you have your innative versus guilt. And that I have here basically is if you succeed, it leads to purpose. Crazy to think, but at that age you feel like you have a purpose. And then you have ages 5 through 12, which is industry versus inferiority. And if you have success in that area, it brings confidence. So you feel good. I mean, 5 to 12, those are critical ages. You're on the borderline of being a teenager. Who doesn't want to fit in towards that age? The next age is 12 through 20, and the roles are identity versus role confusion. Nowadays, especially, those ages again are very critical. You're learning things, you're seeing things, you're acting in things, and you ask, who am I? That's a lot of questions. That's a big question that a lot of people ask. They're trying to find self. They're trying to find their identity. So again, that is identity versus role confusion. Then you have from ages 20 to 40, which is your intimacy versus isolation. And that's when you build relationships, sexual relationships, friendships. But again, you're trying to get to know self. You're seeing what you like, seeing what you don't like, trying to fit in more in the relationship category. And if this is not mastered, you experience loneliness. The next stage is generativity versus stagnation and self-absorption. And that ranges from ages 40 to 65. You would think somebody that's 40 would kind of have it together, but they don't. They're still, again, trying to figure out self, trying to figure out life. They're falling under that bracket of having to support sometimes their parents. So it is a lot that goes on in that period, again, with self. The next one is integrity versus despair, and that covers ages 65 until death. And that is, how satisfied do you feel with your life? Do you feel a sense of achievement? Have you done what you felt like that you were put here for, or felt like that you did a purpose, or you had a purpose in life, and that everything that you did meant something? It wasn't in vain. Or if not achieved, you could feel like you did nothing with your life, and there's a lot of regret and resentment. So again, these are Erikson's theories. Erikson and Maslow are very important to the health industry, because again, it gives you, Erikson gives you more of a timeline, an age line. So you kind of know, at this age, this patient should feel like this. Is it a good sign? Is it a bad sign? And you can work from there. So again, here's my notes. If you can see that. It's a little blurry. And some more notes, if you can see that. I know sometimes people like to write stuff, so I want to hold it up here long enough that if you need to, you can pause this and kind of look at it. I know sometimes when I'm watching YouTube videos, I'm like, oh my God, you're going so fast and I can't keep up. So I do like to write things down. That's another thing with studying. I am a very, I know I'm not going to use the correct terminology, but a seer, a hearer, and a writer. When I see it, I hear it, I write it, I remember it, I retain it more. I hate to read. Not even gonna lie. I hate reading. I don't do good at reading. I don't learn from reading. There are some people in my class and in life that will read a book, understand it, go to a different book, get some more, absorb it. Not one of them. Not at all. So I mean, again, your study style, that all goes back to being in study groups. If you're talking in these study groups and you have someone that is good at reading, that read the book, that knows that this is how this should be, this is why. You have someone that says, well, when I heard and when I saw in class, the instructor said this. Those are things you can question. Those are things that will make you stronger, because those different source sites just gives you more information. And sometimes it may not all seem like it goes together and seem like it makes sense, but it does in the long run. They all fit together. Sometimes you just have to get clarification on that. So back to my notes, and here we go with one of my favorites, because this is it's very important in the nursing practice. You are going to use this next one every day of your life as a nurse. Remember it, eat it, absorb it, live it, love it, because it's not going away. Okay, so the next one we have is what we call ADPIE. ADPIE. And what this simply stands for, you have your A, which is assessment, and that is going to be collecting data. It's going to be organizing, documenting. Assessment is done throughout this process. Every step that you go through, regardless of what it is, you are still assessing your patient, because some things could change. You see it, you're told it, assessment. You are taking that data in, you're understanding that data, and going forward from the data that you're giving or that you have seen or heard or felt. The next one is D, which is diagnose. And diagnose basically means that you have you've analyzed, you've identified from the information that you were given, or again, the information that you see, feel, hear. The next one is plan. So after you've assessed, and diagnosed, you want to put a plan in action. What is your desired outcome? What do you want to happen from what this patient has told you? What do you feel like would best fit this patient? That's going to help, that's going to work for the patient, is the most important part. Because if the patient's not into it, it's not going to work. So therefore, any planning that you do is going to fall by the wayside if the patient is not on board with it. Remember that. Don't put too much into planning if your patient's not on board, because it's not going to get done. And therefore, you're just going to have to repeat the whole thing over. Which, by the way, ADPIE is a circle. It's always going around. It's always continuous. It does not stop. Continue, continue, continue. Remember that, because it's going to be on a test somewhere. ADPI, or the nursing process is what ADPI is actually, is a nursing process. ADPI is a circle, does not go away, does not stop. You're always assessing. You're always trying to assist your patient. The next one is your I, which is implement. So when you implement, you want to put things in action. You want to document. You want to document care and then give responses. So implement basically just is the action that you are going to do because of all of the things that that were prior, everything that you found out. What is your plan? What do you want to do? And put it in action. And then you evaluate. So when you evaluate, did your plan work? Was the final final step what you anticipated? Was it your outcome? If it was not, why? And then you start again. Circle. So again, nursing process, ADPI, does not go away. Become familiar with it. I mean, it's pretty easy. It gets trickier, I will tell you, especially with diagnosis, because you have your 2-part, your 3-part. We'll not get into that because it was not on test 1. It will be on test 2. So I will talk to you guys about that later. But ADPI, remember it. Again, breathe it. Remember it. Live it. Love it. All right, and then just a few more things that were kind of helpful. Little synonyms, I think they're called. You have your ADLs. ADLs, which are activity of daily living. These are things that patients do, or anyone does, on a normal basis by themselves. Things that you don't think of, like brushing your teeth, washing your face, washing your body. Some of these things are compromised as people get sick. Things happen. So ADLs, activity of daily living. You know, again, there are things that we do all the time, but just a synonym, excuse me, for that. The next one we have is a fun one, and it's what we call AAO times 3. And this means when you have a patient and you go to assess them, are they awake? Are they alert? And are they oriented? Sometimes you will have a patient that are AAO times 2. They may be awake and alert, but they're not oriented. Or they could be, let's see, awake and oriented, but not alert. So again, that can fluctuate. But the times 3 is when they're all 3. They're awake, they're alert, and they're oriented. Times 3. And our 3Ds. This has a lot to do with geriatric stuff. And our 3Ds are delirium, depression, and dementia. And delirium is an acute state. If sometimes a severe UTI can cause delirium, but again, it is acute. And when we say acute, usually acute lasts, I believe it's 4 months, or might be 6 months, sorry, or less. Anything above that is chronic illness or disease. So again, delirium, a UTI, severe UTI can cause delirium. Where it's short-lived out. A patient can bounce back from that, to say. You have your depression, which a lot of us know, when you're depressed, you don't want to do anything. You don't feel the need to go on in a sense. You know, you don't want